beautiful people, and welcome back to my channel. My name is Miana for those of you that are new, and today I will be doing a video on tips on how to survive nursing school. So this video is basically for people that are in nursing school that need help studying. For those of you who are just entering clinical, I just want to map out some things that I do and hopefully they'll be helpful for you. So I am a senior. I'm in my 7th semester. I am currently taking Med-Surg 2, Community and Public Health Nursing, and Legal and Ethical. So I'm pretty far along, and I've taken many classes that you all have taken or are about to take. That includes Foundations, Patho, Med-Surg 1, Women's Health and OB, PD, Research, Informatics. I mean, the list goes on. Pharmacology, all. So I just want to start off by saying that this video will not include clinical stuff. I would definitely do another video on that about how I prepare for clinical, what's in my clinical bag, all that good stuff. But today is basically gonna focus on the lecture side of things and exams and studying and everything that you don't do when you're not at clinical. So I basically want to start off with note-taking. So a lot of people use devices like iPads and laptops and stuff, but I personally am a paper person, so I like to print out my PowerPoints and use my textbook in hand. So something that is key that you absolutely need when whether you're doing notes on a computer or on paper is color. You have to have highlighters and colored pens, because I don't know anybody who just likes looking at their notes in black and white, okay? You need something to stimulate your mind when you're reading notes for hours, okay? So the way that I do it, I usually take like one highlighter for headings, another highlighter when I'm highlighting notes and stuff. I use different color pens for different things, for like if the teacher says this will be on the test, or if you have to add little side notes, I use that in different colors. I got these things from Walmart in the school supply section, so it's not hard to find the paper made like felt pens and colored pens to take really good notes. You'll thank me later if you haven't tried it. Another thing that is super good to have are Post-its. You definitely should use Post-its during lecture and when you're note-taking. I use these on my notes, like if there's something that the teacher is explaining and I don't want to just make a mess all over my notes, I stick it on a Post-it and stick it on the slide so that I can refer to that. I use these Post-its, like the tag ones, in my textbook, okay? This is my Med-Surg textbook, and as you can see, I have a bunch of Post-its and flaps hanging out the top. And I use this to help you navigate through the book, because I mean it covers an extensive amount of information. So I put this in here when the teacher's telling you to refer to a certain chart or a certain table. You stick that in there. I label chapters at the top, so it's just easier to find, and this will help you too when you're like studying for finals or just trying to find information so you're not flipping through the book the whole time. So I would definitely invest in some Post-its. Like I said, you can find that at Office Depot, at Walmart. I'm sure you can order them off of Amazon. They are extremely helpful and cool to have. So on the topic of lectures and notes, I think that a lot of people should really look at nursing as a full-time job. It's crazy to say, but it's true, because nursing, we all know, takes a lot of your time, and it is best to try and study at least a little bit every day. I know that I don't do it every day like I should, but I try to study as much as I possibly can. So the day of your lecture, you should definitely go back home the same day and re-listen to the lecture, pick up anything that you left off, and just go over those notes just to have in the back of your mind. And then you do that every day, and then slowly but surely everything is building up and it's there, and you have studied all of your content. So I definitely recommend the same day of your lecture going to the library or the coffee shop or your home and just re-looking over those notes and making sure you truly understood everything. So that's a good tip. A little bit goes a long way when you're studying like that. Another thing, when you're studying, I personally do this and I find it very helpful, is when I don't understand something, or like I have a question about content that maybe wasn't cleared up in the book, I go to YouTube. YouTube is extremely helpful with this, okay? There are 3 channels that I use all the time, and it is Registered Nurse RN, Level Up RN, and Osmosis. So Osmosis is mainly the patho behind things and disease processes. They'll mainly give you like the backup information that you'll need. But Registered Nurse RN, she will break it down for you, okay? She will give you diagnostic tests, interventions, just possible problems that your patient might have with this disorder. I mean, she's awesome. And Level Up RN, I love her channel because she gives you everything very precise. Her videos are usually really short. She gives you everything you need in a short period of time, which is awesome. But I mean, I love all 3 of those channels. They are amazing, and they're really helpful. Another thing, which I'll talk about more when I do the clinical video, I like to watch simulations as well, because you may think you know a lot of what you would do for your patient in that case, but when you watch those simulation videos, you're actually seeing people doing it, you know, and that can show you like, oh yes, my mind was in the right place, or yes, I know what I would grab next in this situation. So those videos are really cool. Another tip is to take advantage of your instructor's office hours. I know at my university, the teachers have to have office hours, and that's a good time to like go in and talk to them if you're not understanding something, if you need some clarification. Mentoring by your professors is extremely important, because we all are just trying to get out of nursing school, okay? So you definitely can talk to them, have them clear up some things, just so you're not drowning throughout your semester. So I definitely would advise you all to take advantage of those office hours. Okay, another tip I have is to practice your skills in the practice labs as much as you can, because your instructors are most likely going to show you a skill that you'll need one time, and then that'll be it, and then you have checkoffs. But then after that, you may not do that skill for like 2 semesters in the clinical setting. So you want to practice that whenever you can, so you can be ready. Like in clinical, you want to make sure you take every opportunity. So if your nurse says, hey, I need a catheter in room 6, you be like, yes, I can do it. But guess what? You got to know how to put a catheter in, okay? So it's important to always have your skills down pat. And I'm looking down here, y'all, because I have my list so I don't forget anything. So another tip that I personally use a lot is when you're studying, it is cool to act like you're teaching someone. So you can do that if you actually have a study group or by yourself. I mean, when you are trying to see if you have a good understanding about a disease process, you can just teach it. Act like you're teaching someone, like you're tutoring someone, and just regurgitate all that information that you know. And I mean, it'll really show you if you know what you're talking about. And if you don't, that means you need to get back to studying, okay? So I think that's a really cool way to really test your knowledge and see if you understand the content. Another good tip is after exams, it's important to like pull out your notes and try and circle and highlight the stuff that you can remember, because that'll help you in the long run when you're trying to study for finals. Not saying that every professor uses the same information that was on the exams for the final, but it can help you narrow down some things, and it can show you, oh, this is what they focused on, you know, so you can be prepared for the final or other exams or just other things that you may not have understood. Another thing is helpful resources are practice questions. I feel that is the best one of the best ways to understand how to truly think like a nurse and understand how to get a feel of what exams may be like. At my school, we use ATI. I'm not sure if a lot of other schools use this program as well, but there's practice questions at the back of the sections in ATI. There's practice questions in your textbooks. There's practice questions you can find online and workbooks that you can purchase that'll really help you to practice taking questions that, you know, are much like the ones you'll see on your nursing exam. So that's really helpful. That's really kind of the only way you can truly practice your test taking skills, is with practice questions. So this last little segment of this video is gonna be some helpful hints I have for you guys when you're trying to think like a nurse, okay? And that is definitely what's gonna help you get through nursing school. I kind of had that light bulb go off, what was it? I think it was the beginning of my junior year when I was in my med-surg rotation and stuff that semester, on how to think like a nurse, because I was struggling a little bit. I was like, I'm just not understanding. I was always picking the wrong answers on like my questions and stuff, until I really figured out, okay, how do I think like a nurse? So hopefully these tips will be really helpful for you guys. So I'm going to be going over ABCs, I'm going to be going over safety, and I'm going to be going over priority. These three things are what most of your questions are probably going to ask you when you're taking an exam. So ABCs stands for airway, breathing, and circulation. You have to keep that in mind, along with safety, when you're answering questions. So your patient, you always check to make sure they have a patent airway of some kind, artificial airway or nose or mouth. And then you move on to breathing. That is getting air inside and outside the lungs and the body. Lastly, circulation. That's your pulses, cap refill, just seeing how the blood is flowing through the body. But first and foremost, it's always airway. Another thing is safety. A lot of questions, safety is what you need to be thinking of when you're answering it. Like if your patient has a fall risk or something like that, you need to keep that in mind when you're handling your interventions or answering a question. Another thing is priority. All the questions always want to know, what patient would you see first? They'll give you a list with the patient and like their diagnosis and stuff. Or they'll ask you which one of these interventions should be implemented first for that specific patient. So those three things are really what a lot of questions focus on, but please remember those ABCs, and remember priority, and remember safety. Remember I told you this. Also, 9 times out of 10 when you're taking a test and the answer choice is assess, that is the answer. As a nurse, we assess first and foremost, no matter what we're doing. You could be walking in the room, just ask them if they need anything. You're still assessing. You're looking to see if they're breathing. You're looking to see what's hanging. You're looking to see if the Foley bag is full, if there's blood in it, or if there's stuff on the floor, or if your patient pulled their IV out. I mean, you look around and inspect the room and inspect your patient every time you walk in there. You assess before you do anything, before you give a medicine. You ask, they have any allergies? All of that, you always assess, okay? Assess. Please listen to me. It's assess. Other than that, I'm trying to think of some other things I can tell y'all. If y'all have any questions, please drop them in the comments. If y'all have any suggestions, drop them in the comments. I mean, we're here to help each other, so just let me know. I mean, I hope this video was really helpful. Like I said, I'll be making a lot of stuff like this just to help you guys get through nursing school, and just to show you guys how I do things, and like how I kind of think about things while I'm in school, or like while I'm taking an exam and stuff. So hopefully these tips were really helpful for y'all. I really hope that you guys enjoyed this video. I really hope that you guys found it helpful. And yeah, I will definitely post another video talking about clinical more specifically, and like how I get ready for clinical, what I pack in my bag, all that good stuff. So I'm excited to do that one. And like I said, I really hope you guys enjoyed this video. I thank y'all for tuning in. I thank y'all for watching. Press that subscribe button so you guys can be updated every time I post a new video, and I hope you guys are looking forward to more. Thank y'all.